If you're at the phase where you're borrowing, just take out whatever you need, but just don't borrow more than you need. Be smart about it.
But how do you find that this is affecting the doctors and other healthcare professionals that you talk to? How does this affect their lives in a really negative way?
It has a huge impact because
Andrew Paulson is a co-founder and lead student loan consultant at studentloanadvice.com. He earned his certified student loan professional designation. Andrew has the passion for helping people find solutions to complex financial problems, and he had the pleasure of advising over 2,800 borrowers, mostly comprised of doctors, dentists, and other higher-earning professionals.
so many of you have dedicated your life to this. They knew they were made for it, and they weren't going to let anything stand in their way, even if it was $200,000 or $300,000 or $400,000 of loans that they were going to have to be shackled with. You are not alone, and many, many others are feeling the same feelings, but having the understanding that you can conquer that you can get through that by having a plan or having some optimal approach. But then the goal is to work on to what's the next steps. How do we stay with the positive? How do we talk about what goes on after that? And it's really helped people out.
Welcome to the Interesting MD podcast, the show about what doctors do when we aren't seeing patients and how this can help us find balance and prevent burnout. I'm your host, Rob Beck. Welcome back to another episode of the Interesting MD podcast. I'm your host, Rob Beck. So today I have a wonderful guest, Andrew Paulson, that many of you would know from studentloanadvice.com, part of the White Coat Investor Network. And I'm very, very honored to have him on. So Andrew, thank you very much for coming on. It's very, very nice to meet you.
Thanks for having me on, Rob.
Yeah, my pleasure. So just to get started, can you tell us a little bit about yourself? Not everybody knows about you, but can you tell us a little bit about yourself, where you're from, where you're coming to us from now, and how you kind of got started with student loan advice?
Yeah, my background is not medicine. I'm not a physician. I was going to be an accountant, going to be a CPA, and went to undergraduate and graduate school on that track. I decided to, rather than go into the accounting business and what's called Big Four, that's kind of a real good starting ground for a lot of people coming out of accounting and finance background. I worked at an investment firm for a number of years in Boston. And we worked with institutional clients and with some individuals, or what they would call the intermediary channel. But about 5 years ago, I was reached out to by the White Coat Investor, large financial literacy platform. And at the time, I was also looking for an opportunity to be a little bit closer to home. I grew up in Utah, and I had moved to the East Coast after graduate school for that employment. And a lot of times when you're growing up in finance, you got to go to the hubs. You got to go to New York. You got to go to San Francisco. You got to go to Boston or Chicago. And so I'm married, and we were pregnant with our first child and trying to reconcile with being 2,400 miles away from family. And that didn't sound too great. And, had this opportunity where the White Coat Investor was looking to hire someone to run a actual student loan consulting business. That is someone who knows medicine, who knows finances, and was willing to take on the intricacies of the student loan space. And my brother is an ophthalmologist. My wife is a NICU nurse. And so had a lot of people around me in medicine that were grappling with so many of those questions and money matters specific to doctors that are tricky. And it was a great opportunity where I could live wherever we wanted to. It was 100% remote. And so, 5 years ago, we took the leap of faith and started this business in conjunction with the White Coat Investor called studentloanadvice.com. And as a result, we were able to come back to the mountains, Salt Lake City, Utah, and have been here ever since. And it's been a real blessing to be close to family and close to so many, things that we love to do. We love to recreate and be outdoors. And so it's been a real nice fit back for us, and a good spot to raise our family.
That's amazing. I mean, Salt Lake is beautiful. I've driven through there on my way when I was moving to Canada. I had driven through, and it was really pretty fascinating. But also, one of the former guests on this podcast, David Guidry, is an ICU doctor who does a lot of telemedicine, but he lives in Salt Lake as well. And he and I kind of went to med school, played rugby together during med school, and he was telling me all about the wonders and the joys of Salt Lake, which is, it sounds pretty magical, honestly, with all the really close ski resorts within 20, 30 minutes away. And
Yeah, when I grew up here and moved away from it, it's one of those things where you don't know how good you have it until it's gone. and
right.
and I've spent some time in British Columbia as well, and in Vancouver and up there, and it feels a lot like Utah in some regard, right? You're not right on the ocean though, like some of the areas of British Columbia, but a lot of the mountain and the alpine feel that is just breathtakingly beautiful. I've spent some time up there as well, in the Banff area and some of those, but has a lot of, kind of ties into the kind of the same mountain scene that you get out here in Salt Lake. So,
wow, that's really nice. Well, so how long you've been at the White Coat Investor? For 5 years now? You've started that 5 years ago?
Yeah, so we started at the very beginning of the year in 2021. So I guess we're coming up on almost 5 years now that I've been working in conjunction with them.
Boy, that was a tricky time. So I moved here in December 2020. So that was a tricky time for new businesses and new life experiences, but also kind of a time where you just feel like, well, maybe life's a little bit short and I just need to go do something different. And you start to realize about, reevaluating. So it sounds like we kind of went through that together. All right. Well, so the big reason that I wanted to talk and have you on is because this is a podcast mostly about burnout. And I find that one of the biggest reasons that I felt a lot of burnout and a lot of other doctors feel burnout is financial reasons, right? That student loans are one of those things. It's kind of one of the very few things that can't get dissolved in bankruptcy. You're kind of, you got it, you have it, right? And that it's one of those things that you just can't run away from. And it has really hit home hard with my wife and I. We were crazy enough, we had, so she's also an internist and we did med school at the same time, but we had 3 children, our first child during 3rd year of med school. And then the second one during our 1st year of residency and our 3rd one during the 3rd year of residency. We tell all of them they were accidents, not mistakes. We make sure that they know that they are not mistakes. But anyway, so we ended up having to take on, I mean, it was just, we're not independently wealthy. And we took on an enormous amount of student loan debt. I mean, not just because of the kids, but it's just the way that it was. But on August 1st, I remember this very specifically because I calculated all of our student loans, and my wife's also Canadian. And so she wasn't a permanent resident. She was on a student visa for a long time. And so she wasn't able to get, federal student loans. And so we were basically taking out loan shark loans. And on August 1st, 2011, when we started our first job, and, everything came out of forbearance and whatever else, our total student loan debt was $667,000.
Oh my goodness.
Yeah. Yeah. So for 2 internists, unfortunately not 2 neurosurgeons or whatever else, but still, like that's a lot even for some neurosurgeons. But for 2012 and 2013, student loan interest was 24.5% of our after-tax income. So after we paid taxes, just under a quarter of everything that we paid went to student loan interest, not the principal.
And this is not residency income. We're talking about practicing income now as internists as well.
Two fully employed internists. I was in 2012 and 2013, I earned 90. I think in 2012, I earned probably 90th percentile because I was still kind of working my way up through the junior contract and whatever for MGMA. And in 2013, I was earning 97th percentile probably of the internist. And that's how bad it was. And
it was still 20, roughly 24% a quarter percentage of your paycheck, even when you were in the cream of the crop or upper quartile as an internist, still had it that tight.
Wow. Yeah. And I mean, that was a large amount of stress for us. I mean, you can't say no, you can't not work, you can't, and there was just, it was really, really bad. It was really, really stressful. And so I take this very personally. I find this subject very, very, uh, personal and important, because I can't be the only ones. Like, she and I cannot be the only ones who are going through this. It's nice if you don't have to go through that, but I just find that there are probably so many people out there who experience burnout because you just can't say no. You just can't say no to doing one more patient, one more consult, one more surgery, one more shift. You just can't get away from it. And so anyway, in your work, I know, surely, hopefully, we're not the worst case you ever heard, but you haven't broken out into hives yet, so I appreciate that. But how do you see that this is, you probably talk to everybody, oftentimes probably too late, but how do you find that this is affecting the doctors and other healthcare professionals that the dentist that you talk to? How does this affect their lives in a really negative way?
Yeah, it has a huge impact because so many of you have dedicated your life to this and felt that maybe you were called to do medicine or whatever it was that led you to get there. And so many people, they knew they were made for it and they weren't going to let anything stand in their way, even if it was $200,000 or $300,000 or $400,000 of loans that they were going to have to be shackled with. And quite frankly, I feel sometimes that I am underqualified. I need some therapy training, Rob. I almost need some marriage counseling training, because so many people are, they're going. I'm meeting with people on their worst day sometimes, as are many of you doctors. They're showing up at the clinic or at the hospital, probably on their worst day, and honestly, sometimes I get a little bit immune to that, because the average doctor I work with owes $320,000 in student loan debt. And that's just what I see every single day. But, usually so few physicians have the tools to navigate it optimally, or even to just be able to grasp it and emotionally kind of endure it. And a good example was just earlier today, I was working with an ear, nose, and throat surgeon in the Pacific Northwest, ENT, and he is 7 years out of medical school. He still has $300,000 of debt hanging around his neck. And he was still telling me, he's like, this is still bringing me down. An ear, nose, and throats, surgeon, right?
Yeah.
And with $300,000 has 4 children. And he just was telling me how, it has still occupied a lot of his headspace and what he thinks about and what he's stressed out about. And so I know it can be a really tough pill to swallow. And I feel like a lot of doctors out there, it can really kind of bring you down. And now there's some others that can think about it a little bit more and compartmentalize and just kind of put this up on the shelf. But I do realize that it can be really revealing and something difficult to share when you're sharing some of the deepest and darkest of what you're going through with the debt. And so I think the overall thought is that you are not alone in this, and many, many others are feeling the same, the same feelings, but having the understanding that you can conquer that you can get through that by having a plan or having some optimal approach has really helped a lot of people. And I am one who gets to see the light go off and, that I can do this. And that's a big reason why I love doing this. I love doing this because, I can take someone whatever their understanding is, whether they are so in the weeds on the finances and a super DIY, to the other end of the spectrum where someone just says, I don't even know where to log in. I don't know what any of this stuff is. It's just too overwhelming.
Yeah.
And so often they just tell me it's too overwhelming. I just can't handle it. And I've realized when you just grab it by the horns and you address it, sometimes, I've been on calls and somebody breaks down. and they just start crying. And it's okay. It's okay to feel, feel that for a period of time. But then the goal is to work on to what's the next steps. How do we stay with the positive? How do we talk about, what goes on after that? And it's really helped people out.
Yeah. Wow, that's wonderful. I'm really glad that you're doing this. I never even thought about it from your perspective that, somebody comes in with a heart attack or, they have a new mass on their CT scan or something like that, that is, again, their worst day of their life. And they come in and you have to be the one who, and all of the doctors get used to being the ones that, okay, well, we have to absorb this. We have to, help you process this, but we also have to make a plan for you to go forward. And I mean, people's finances and their livelihoods and, their home is at stake and their, family may not know how much debt they're in. Their children certainly don't understand how much debt they're in. Their children their family, their friends, they just think, oh, you're a doctor, you're a surgeon, you're a whatever, that you must not have any financial concerns. And you never know at 18 when you commit yourself to these lifelong careers that when you're 35 and you get your first job that you're going to be $400,000, $320,000 on average in debt. So I'm glad that you're here. I'm glad that you're learning the skills that we that we all have to learn slowly over time as well to pick it up and to help people through this. But I did not realize that. So as part of all of this, I don't want to waste your time today very much, but as part of all of this, the new, what is it? The One Big Beautiful Bill. I didn't like to say Obamacare either, but the newest legislation has a lot of impacts on student loans. I know that this is something that you end up having to talk about a lot right now, but can you just kind of briefly, as you can, explain what has happened with student loans with this new legislation?
Yeah. So I'll just call it OBA.
Okay.
Because One Big Beautiful Bill Act, OBA, a couple of things occurred. And, even before that, something else that's relevant for a lot of you you may have been on an income-driven repayment program. So that is, there's a handful of federal repayment programs that are set up for student loans where rather than paying on a time-based system over a 10, 15, 20-year plan, kind of like a mortgage, it's more based on your income. And this is most common for those of you that are residents, that are fellows, and if you're interested in doing loan forgiveness programs such as public service loan forgiveness, which many of you are. Many of you are probably doing PSLF and are trying to, pursue that route. Well, the SAVE program, that was one of the income-driven repayment programs that was created by the Biden administration and was really the most generous payment program out there, where payments were about 10% of your income. And when you were early career, like a resident or a fellow, it meant that as long as you enrolled into it and made your required payment, the balance would never go higher. So that is, if you came out of medical school with $250K and you were in, 7 years of surgical training, you wouldn't come out of training with $350,000 like so many do because of all the interest that accrues on the loans. Okay. So that, and I think that probably happened to you and your spouse, Rob, that having borrowed and you realize, wait a minute, we borrowed 300. How did this turn into 400 or 500,000? Right. And it can really get out of hand quickly. So there was this SAVE program and there was a lawsuit that was brought against it in the summer of 2024. Okay. And that's relevant because it ties into OBA. And one of the big reasons why they were trying to reform or modify loan programs. Okay. And so there's really two big kind of groups that I would say that are impacted by OBA. And those of you that are already done with medical school, there's not huge, massive changes where you should totally uproot all of your approach to paying down your loans. Okay. That is, they took the 4 existing income-driven repayment programs, SAVE that I've mentioned, that was already kind of in trouble, another one called PAY, and income contingent repayment. So those 3 payment programs are being phased out by July 1st, 2028. So that means if you're in any of those plans, you got to look at switching payment programs. But now you're probably wondering, well, what are we left over with? One that's called income-based repayment, IBR, And another one that was created as part of the OBA is called RAP. That's Repayment Assistance Plan. And that becomes available on July 1st, 2026. Okay, so there was some changes to repayment programs, but for those that are already out of medical school, already done with all of their borrowing, you can select IBR or the RAP plan next year. If you are still in medical school, okay, the only repayment program that is income driven that will be available to you is called RAP. That is because if you borrow on July 1st, 2026 or later, that's the only option. And there's some good and bad into that, okay? It does have some nice features that are kind of like the SAVE program where payments are about 10% of what you take home. So when you're a resident and you're taking home $5,000 a month, okay, it's probably a $300-400 payment. But when you're an attending making $300K and you're making $25,000 a month, right? Well, then you're going to have a size, a bigger payment around that $2,500 range. Okay, so that's going to be the only payment program that's eligible for the newer borrowers, or really those that are currently in medical school. Furthermore, and this is where it's really going to change for repayment just in general and borrowing in general, is that starting July 1st, 2026, the maximum amount you can take out for medical school is $200,000 federally. Okay, so what that means is each year you can only borrow $50,000. Well, there's a medical school that's in my home state of Utah, and it's a DO program. The tuition's about $80,000 per year right now. And then you got to take out loans to live, right? You were feeding your family, right?
Yeah.
And so what happens is you probably borrow another $30,000. So you can take out $100,000. And previously, the federal government allowed you to borrow. There was no cap on borrowing, which is, we could talk about the merits of that. Is that a good thing? I don't know. Is that a bad thing? I don't know, right? With no caps on borrowing, schools will just keep bumping up their prices, which is there's good and bad on that on both sides. But that aside, if you needed to take out $100,000 federally, previously you could take it all out, from the federal government with these Stafford loans, or what are called plus graduate loans. But now it's only going to be $50,000 you can take out per year. So picture a new doctor who's starting medical school in 2026 or dental school in 2026 that needs $400,000. Well, how are they going to get it? Half of that's going to be federal, and the other half are going to be through private student loans. And generally, as you've kind of been in the middle of this, Rob, paying off, your wife's private student loans in her world, they don't have the federal protections. They don't have income-driven repayment. They don't have public service loan forgiveness. They don't have the same death and disability discharge that federal loans have. And so what this is going to do is it is probably going to push more doctors towards less academic roles, less roles at non-for-profit institutions. And maybe they're going to be living in very rural areas trying to do geographic arbitrage where there's less doctors in given areas to earn a higher salary, because no longer will you come out with $400,000 federally that would all be eligible for forgiveness if you're thinking about working in the VA or working in academia, right? Now it's only a portion of that can be forgiven. So as we take a step back, likely what is going to occur there is a lot of these doctors are going to be taking it on the chin. It's probably going to be more expensive. Okay. Now, will private lenders come up with more unique ways to lend that are probably more in line with what federal loans are? Perhaps. And I think there's some thought that will occur. But as a general rule, private loans are usually a little higher rate, and they usually have less flexibility. And so really the jury's still out on that, as well as I don't know that medical schools are going to drop their tuition. If many of you are anything like my brother, who when he was 5, he wanted to be a surgeon, and there wasn't going to be anything that stood in his way to get there, even if it meant taking out $300,000 of loans. And so for those that are going to be starting their medical school or their dental school journey in 2026 or later, just know that you're going to need to be taking out more private, in the long run.
Wow. That's just, Insanity. I mean, I understand. I totally get what you mean about maybe not having just an unlimited amount of funds that you can borrow. But that is what fed my family. It's what got us through. Yeah, that's our private loans. My wife's private loans were at prime +5. And at one point during residency, we were rocking 13.5% or 13.25% interest rates on $140,000. I mean, that's
It doesn't take very long for that to double.
Yeah, no, that's what, about 5 years to double, something like that. And 5.5 years for it to double. And it was just, it's overwhelming. It becomes overwhelming very, very quickly. So, and when you're 18 or even when you're 22, 23 years old, 25, and you enter into med school, you don't really understand the consequences of all of that. So, hopefully what I'm going to take from this and encourage other people to do is to get in and talk to you earlier rather than later. In medicine, we really do believe in primary care and primary prevention of issues, right? Like, come in and talk to me maybe about your high blood pressure, your diabetes, and your cholesterol before you have the heart attack, because it's a lot easier to deal with it on up front, and maybe we can avoid a crisis. So hopefully people will take that away from today, and that they'll get in touch with you sooner rather than later.
And I hopefully I'm not painting this whole doom and gloom here, Rob, but I want to, I also want to say that you can do this, right? That it is not, it wasn't what it once was, where 25 years ago you could probably pay your debt off in 1 year at a medical school, and it wasn't that big of a deal. But I know you can still do it, right? I know it can still be a good move for you financially to go to, if you're so inclined that you want to practice medicine. And hopefully we're not shying people away that this is a total disastrous, it's a big mistake, because you can have a great life, and you can, and what I usually tell my clients is, I want you to be out of debt within 10 years of when you got out of medical school, whether you're doing forgiveness or you're just going to pay this all off, and then you have a clean slate. So,
well, there you go, guys. That's the goal. Any other changes with this, or with the One Big Beautiful, the OBA? Any other big changes from this, or?
Yeah, there's a few other things that are not as relevant for physicians, but if you are going to graduate school beforehand, maybe you need to do master's before, or it's just, you're so inclined that you want to do more studies, you can only borrow $100,000 for non-professional degrees. So you're going to do an MBA or a master's of public administration or health administration, right? Know that the cap for borrowing at that level is $100,000 as well. And if you're looking to take out loans on behalf of your kids, these are called Parent Plus loans. And I usually try to recommend against taking those out, and just try to save up money for your kids to go to school and to help them, and have them take out what they need so they have a little bit of skin in the game. But these Parent Plus loans used to be, there was no cap. You could borrow $100,000 for your kid each year if he's going to, he or she's going to Bucknell. And and now they are limiting that as well. So there's that piece to be aware of. One other thing too is there is what's called forbearance, and it's different from what is deferment. So while you're in school, you don't have to make payments because you can be on deferment. Now the loans tend to grow while you're in deferment, but you don't have to make payment. But when you're done with medical school and you're in residency, or you're done with training and you're in practice, if you're not in repayment, your loans can become delinquent, and that's when they can start hurting your credit. And if you're delinquent for more than 9 months, they start to, they move into default. And that's where things can get kind of pretty messy, where your credit just starts going way down. But what they offered as a means of temporary relief is called forbearance. And that's where you don't have to make payments for a period of time. Sometimes you come on hard financial times, or you just can't afford that $400 payment in residency because you're living in New York City, or you're living in, downtown Seattle, and you just can't afford that payment, right? Well, they allowed forbearance previously for up to 3 years, and they are shortening that to 9 months. over a 2-year period of time. So that's another big thing that you need to be aware of, that there's not going to be quite as much flexibility as far as, or leeway, let's say, on putting off payments. And so if you are struggling with trying to figure that out, right, you really got to look into some of these income driven plans that can be a lot more affordable. But just know that things are really moving back into repayment for probably the first time in about 5 or 6 years for a lot of docs out there.
Wow. Okay. So does this change anything for the current student loan holders, or not so much for people who have already finished and are in residency or now have their attending jobs?
So there is an it has not yet been implemented as far as that change, but I would likely think that it's probably for anybody that's still in medical school right now or is going to be starting in subsequent years.
Okay. All right. Very well. What about the public service loan forgiveness, the PSLF? Is that going to stay in place, or does that change?
Yeah, this is a fantastic question. And I think it's a good idea to talk a little bit about, what does this entail? What does PSLF entail? So there's 4 rules. Number 1, you have to be working at a non-for-profit institution. That is getting a direct W-2 from your employer. It's a nonprofit. And there's actually a little bit of a loophole to that I want to talk about today, but that's the first thing. Directly employed at a nonprofit, working at least 30 hours per week. You need to have what are called direct federal student loans, which is what the government offers these days. If you've borrowed in the last 15 years, they're probably direct loans. And then the 4th rule is that you need to be working at least, let's see, qualifying employer, qualifying loans, 30 hours per week are the rules to get you eligible. Oh, and on a qualifying income driven repayment program, that is the income-based repayment program or the RAP plan. And so the PSLF program was created 18 years ago under the Bush administration. It was signed into law by Congress. And this is a really big deal, because one of the first questions I always get is, hey, is this PSLF thing going to go away before I get there? Oh, it's got to get shut down, right? Or they're going to tax it, or there's going to be something that's going to withhold my eligibility from getting there, right? Because in the early days with this program, there was very few people that were getting it. And now when you look at the data, there's 1.1 million borrowers that have qualified. Okay, so there's a lot of people that have qualified for the public service loan forgiveness program under the Biden administration, as well as under the Trump administration. A lot have asked, hey, shifting policies, shifting politics. Hey, is this thing still working out? Yes. I just had a client earlier today that I met with a year ago, $440,000 discharged through the PSLF program. Really a life-changing thing. And
oh my God.
Sometimes it really kind of puts tears in my eyes, right? When I can see them win. Right. Or you can see that with your patients. When you see your patients take steps to, become healthier or exercise or whatever it is, it's really fulfilling.
God, that's like becoming cancer free. I mean, that's unbelievably life-changing.
Yeah. So I'm still seeing it work. And I've had about 400 clients that I've firsthand be able to witness get over the line. And so this program is still working. Now, is it going to work for me in 5 years, right, is the question. And what came out of OBA was that there was nothing they could do to shut the door for the PSLF program right now. Okay, now there are some other kind of executive orders that are trying to impact this and tweak the eligibility around the edges. Like one was they were going to try to make all non-for-profit hospitals taxes for profits, and make it so, hey, if you're working at a hospital that's a non-for-profit, well, it's a shadow for-profit organization, right? And that has not gone anywhere. There is also another executive order that has been worrisome to some other, many doctors out there, that if you're working at a hospital or an institution that provides gender affirming care, that may also fall outside of the scope of the PSLF program, but it's still really early days. Okay, for that to go into effect. And I have not seen much talk about that, as it's been about 6 months since they've talked about that. And as far as the rollout, would it actually be the physicians that are providing the gender affirming care, or is it going to be at a big academic institution that just provides it, right? And so more to come there. But that's kind of this current group that are already eligible and qualifying, that this program, it works. And after 10 years of payments, they forgive whatever the outstanding loan balance is tax-free. But for those that are just starting medical school in fall of 2026, there's going to be less forgiven, right? Because you can't borrow $300,000 or $400,000 or $500,000 plus federally any longer. It's only $200,000 that you can borrow for medical school, and a little bit for undergrad, right? And so I see this kind of as a way, Rob, where they're watering it down, right? That, the doctor that I worked with a year ago who had $440,000 forgiven, could they still have benefited from the PSLF program with the new rules? Yes, but they wouldn't have $450K forgiven. They'd have probably $175 forgiven.
Yeah. Still nice, still worth enrolling in the program, right? So
certainly,
I mean, I guess what's the worst that can happen is that you go 9 years and you've been paying on the income-based repayment and you've had a good job and you're still paying on it, and then they take it away so that you're still like at that point, what do you do? I mean, I guess that it's too early to know, so you wouldn't know. But I mean, worst case scenario is that you're making income-based repayments for 10 years and then they change the policy, right?
And something is, you just don't leave this up to chance. And that is, once a year, you have to certify your income on these income-driven plans. That is, they ask for your tax return or a pay stub or something, and that's how you stay current with your payment. Otherwise, you would enroll as an intern when your payments are like $200, and then you're an attending physician someday with a whole lot higher income, right? Department of Education is smart enough to realize that they do require you to certify income every year. But another aspect of this is you have to certify your employment. So that is, if you're working with the local the local academic institution, whatever city you're in, or nonprofit or community hospital, okay, you need to be certifying your employment once a year. And if you're doing that, it's kind of this check year after year that you're progressing on the path. And I haven't met with anyone who has fulfilled all the requirements and has gotten to the 10 years and they've not had their loans forgiven. Where I've seen people struggle with this is they just kind of, throw stuff up against the wall after a decade working in public service. And they're like, oh, hopefully this works out, right? But I think from the get-go, if you're making these little steps to ensure that, they're counting everything, they're qualifying everything, you just don't want to leave this up to chance when this can be hundreds of thousands of dollars, right? And so know that it is working, and that maybe you just check in on this if it's going to be moving the needle that big in your finances.
Yeah, wow, that's really amazing though. $440,000. I still can't get over that.
And Rob, can I one other point I forgot to mention?
Yeah, please.
Is, if you're a physician in California or Texas, there is a specific rule change wherein you don't have to be directly employed by a non-for-profit to qualify for the PSLF program. So often when you're living in any other state, you need to be directly employed by a nonprofit. But a lot of physicians are part of groups or practices that contract at hospitals. Suppose you're in a surgery group and you're doing surgery at a nonprofit hospital, 3 days a week, right? That would still qualify for the Public Service Loan Forgiveness Program in California and Texas. And it's because they have specific laws that bar your employment as a physician to be directly employed by a non-for-profit. Academic institutions, VA, government, they kind of fall outside of the scope of that, and you can be directly employed by one of the big academic centers in those states. But I just want to plant that seed, as I've worked with many, many doctors in both of those states that didn't know they qualified, that, had, met the criteria immediately and had their loans forgiven.
Wow. I mean, that's a lot of doctors in California and Texas. So talk to Andrew, figure out.
What is it, like a fourth
possible
of the country?
Right. Like 70, 80 million people live there.
Yeah.
So, okay. All right. So for future student loan borrowers, do you have advice for them? I guess before I say that, if somebody is looking at, like, I have 2 boys who are in undergrad right now. Fortunately, they're in Canada, and so it's much cheaper. To be honest, it's crazy how much cheaper it is. But let's say for people who are they have kids that are in undergrad, are they capped? Is there like an undergrad cap for this $50,000 a year? Is that only for professional schools, or is that for undergrad as well?
Yeah. So in undergrad, if your child needs to borrow, they have a couple of options. They usually have federal loans, but you can't take out that much each year undergrad. Rob, it's probably about 10 grand. And they change the limits that you can borrow federally for undergraduate each year with inflation. But it's not a whole lot that you can take out for, undergraduate, right? And so
Yeah.
as best as you can, try to cash flow the education for your children. Maybe it's coming from a 529 plan or some other education savings fund, or even just from a brokerage account, right, to try to pay for some of that. But know that the $50,000 cap, that applies if they're in professional school, medical school, dental school, that sort of thing. But for undergraduate, different amount.
Okay. All right. Very well. So for any of those people, so now you would recommend, hey, try and, again, cash flow, start saving now for your kids, or try and figure out some other way or scholarships, obviously.
Yeah, I have 3 kids, and that's a big area, as mine are still young. I don't have my oldest is in preschool right now, so I've still got, hopefully 15 years before I'm going to have to make those decisions, but trying to save so that they can, have a better life than me. I think that's what so many of us want, right? Yeah. And then, at a certain point in time, if they want to go to graduate school, or they want to go on to, a professional schooling, medical school, dental school, something like that, they're probably going to need to take out some money, right? And I think it's okay for them to take out some money, because then they also have to learn and get their arms around it. But hopefully I could help a little bit if they're going to go to med school and not leave them with $400K, but leave them with $100K, which is a lot of money, but is something that's a lot easier.
It's manageable.
It is. It's more manageable for them. So, and I think that the ROI is certainly still there, even if it is more loans are going to be private. But I would just say, if you're at the phase where you're borrowing and you're looking into that, just take out whatever you need, take out federal loans first. And then if you've exhausted the federal options, that's where you can start to dip into some of the private loans. Okay. But just don't borrow more than you need, right? Don't borrow for, a big trip in Bali over the summer, a couple of years in a row, right? And, just living on loan money, just be smart about it, right? Because it's a good time, you're poor when you're in school, right? And it's okay to, be that way. And
everybody expects you to be poor. So
we you do. And then you learn those financial habits, and it makes it a whole lot easier later in life when you have excess and you have surplus.
Okay. Any other advice that you would give to parents or to children who are facing undergraduate, graduate tuition cost, and anything that you might tell them? Or, what kind of planning would you have? Do you continue to expect the inflation? I mean, do we know how this new policy is going to affect tuition inflation? Because I can't even imagine thinking about what undergrad is going to cost in 15 years when your oldest goes to undergrad.
I know
costs continue to inflate like they have, right?
Yeah, and I mean, and maybe what ends up happening is, I know there's some things that came out of the OBA that are supposed to hold more schools accountable for, providing degrees that provide value. And if they don't, that they're going to start to consolidate programs, or even consolidate schools, or eliminate, or reduce funding. And so I don't know if there's less players, does that mean that tuition goes up? I don't know. I mean, I would just anticipate that there's going to be an increase, right? So I think that if they're not quite there yet, to start saving early for these decisions, so you have some compound interest that is helping you along the way. But if you're now in the driver's seat with them, if there isn't enough funding, that there's not enough savings to just pay their way, just have them borrow federally. It's got the most flexibility, and then if they do need additional loans, that's where you can talk about taking out the parent loans or private loans. But I really try to steer away from those private loans, the Parent Plus loans if possible, because they're 8% and 9% right now. And if you can get a little bit lower rate privately, that's fine. So
that is one of the biggest things that did help us, I know that we're kind of running out of time here, so I apologize, but we actually were able to go to one of these other private loan companies who got out there and they really did start giving us an ability to consolidate my wife's really high interest rate loans. And we were able to consolidate them for a much lower interest rate, even if over a shorter period of time. And that made payments stable. And it was really, that changed everything for us. That helped us to get costs down, and it helped us to be able to pay off some of the smaller loans that we did. So, I mean, for us, SoFi does not sponsor me, but if they wanted to, I'd be willing to talk. But they really did make a huge difference for our family. That's how we were able to consolidate a 13% loan into something that was at 6.875, which doesn't sound amazing right now, but when you have the interest rate, that is just absolutely amazing.
Sometimes that can move. I mean, and when you're going from double digit and cutting it in half, like you did, that could save you $100,000, save you $50,000, $75,000. And if you're not in the forgiveness camp, you're not thinking about doing PSLF, maybe you owe $100K or $150K, and you're making $400,000 as a hospitalist working in locums or in some private hospitalist group that's contracted in a hospital. You just fall outside of the scope of forgiveness, right? That's where you may want to refinance. Why are you holding on to these 7 or 8 or 9 or 10% interest rate loans when I just had a client the other day got 3.75 to refinance their loans out of the federal government to private? For her, it was going to save her $50,000. She's like, wow, I'm going to have to pay this off anyways. Why don't I just get a better return on my dollars and have less overall costs? So no, that's another approach that you can think about is if you're not doing forgiveness, where the goal is to try to pay the least amount over the 10 or, however long the term is of repayment, then how can I get out from under this in a manner that's more cost effective? And sometimes that can be refinancing. And you definitely want to refinance your private student loans. If you have federal student loans, consider refinancing those if you're not going to do forgiveness.
Yeah. Okay. Can you just tell me what was your greatest success story so far in the 5 years you've been doing this? What's been the greatest thing that you're the most proud of?
Oh man, this was really hard when I was thinking about this because I have all the time, but I'll tell you one story. So I was working with an emergency physician, and he went to medical school, graduated from medical school in 1984. That was before I was born. Okay. And he had paid off his loans for his schooling, but he had taken out $350,000 in Parent Plus loans on behalf of his children that went to, had wonderful educations at various schools across the United States. His thought was, I don't want them to have to deal with what I did. And he wanted to give them a better chance. And he also took over the responsibility of the loans. And because sometimes parents will take out loans on behalf of their children, and then the kids will pay them off, or they'll take them out of their name through refinancing. But he had this group of $350,000 loans. Well, over a decade, lives in the Bay Area, the balance had swelled to $500,000. And we met 2 years ago, and here's this physician, 60 years of age, starting to look at retirement and look at life after employment, after medicine, sitting with $500,000 thinking, well, I'm going to be paying on these loans until I die. Right. And these are going to stick with me. Well, it turns out his employer had just become eligible for the loan forgiveness program a month prior. We walked through the paperwork, kind of ran through things. And about 2 years after we met, he had the $500,000 of loans forgiven. And, it kind of shook me up a little bit because, now he had the opportunity to finish out his days as the chair of his emergency department, saving for his retirement, and not just doling out these loans, doling out all of his money on these loans, and potentially carrying them and working until his 70s. And work had then become optional for him. And those are the sorts of things that I get to be part of, and just to be this one little piece on people's journeys. But I know for him, it was life-changing, and it will provide him, now he can spend more times with his grandchildren and not have to worry about that.
Unreal. You've changed people's lives. I mean, you changed the entire trajectory of a family there. And you're working miracles too. And I hope that you understand that. All right. So how can people get in touch with you?
Sure. So studentloanadvice.com, that's our website. You can explore there. If you do want to set up time and we have a flagship offering where we sit down and do a one-on-one consultation for about $600 at studentloanadvice.com/book.
And that could save you almost $500,000 potentially, or even more. So, all right. Well, Andrew Paulson, thank you so much for coming on. This has been really helpful to me, and I hope that it's been helpful to a lot of other people. Thank you for all the great work that you're doing out there. I hope that you can come on again sometime.
Thanks, Rob. Appreciate having me on.
Oh, thank you. Thank you for listening to another episode of the Interesting MD podcast. Please check out my content on YouTube at Interesting MD and follow me on TikTok, Blue Sky, Instagram, Threads, and Facebook at The Interesting MD and on X at Interesting MD. If you have comments or questions and want to get in touch with me or any of my guests, please DM me on socials or email me at rob@interestingmd.com. If you have any ideas for a show and you want to share your hobbies with me or don't know where to get started on your own project, you can email ideas@interestingmd.com. Please like and subscribe to the podcast and YouTube channel to get the latest content. Much appreciation to Falter Media for editing, producing, and posting all Interesting MD content. Check them out because if they can do this for me, imagine what they can do for you. See you next week.